All right, I'm Dr. Ebony, and I am back with Dr. Harold Schoenhaus from Philadelphia, Pennsylvania, and I'm so excited for this interview. He has been in practice for over 30 years,
50.
over 50 years. There's so many pearls of knowledge that we can acquire during this interview, and I just wanted to say thank you first and foremost for all of your hard work and dedication to podiatry and willing to learn right now. So please just introduce yourself, tell us a little bit about your background.
So, my name is Harold Schoenhaus. I practice in Philadelphia. I've been an educator for 50 years, been involved with resident training, directing this profession in the area of academics and excellence in the treatment of foot and ankle pathology. I'm past president of the American College of Foot and Ankle Surgeons, and I'm the surgical editor to Present e-Learning. So my thrust in life as a foot and ankle surgeon is not only to focus on surgery, but to focus on the cause of deformity, what we refer to as the biomechanics or function of the foot, which even after you operate on the patient, that foot has to still function again. There are so many areas in the area of foot and ankle pathology that podiatry treats that people should not go into this profession thinking it's only a surgical profession.
About percentage-wise, how much surgery would you say that you've done in the past, and how much would you say can be treated as non-surgical patients?
I've done thousands of foot and ankle surgical procedures because of referrals that are complicated cases, trauma from the emergency room, congenital deformities. But I would say at least half of my practice has dealt with conservative approaches, sports medicine, utilizing orthotic management control to make patients comfortable, dealing with heel pain syndrome, which is a very common type of problem, most commonly treated conservatively, rarely treated surgically, wound care management, diabetes, the fact that pediatric problems, youngsters who have toe-in problems, flat foot problems, these are all of the areas that are exciting that we can do as a profession. And then, of course, the last resort is surgical intervention.
Do you find that a lot of patients that come to you, are they seeking a surgical option before considering a conservative option? And if they are wanting that surgical option, how do you approach or telling them about their condition and telling them how conservative options work?
Well, my practice was largely referral. So a lot of patients came to me who had been treated conservatively prior to seeing me. That being said, I still am conservative in my approaches. If I feel that I can alleviate their symptom complex, from a conservative standpoint, I would rather do that first. That being said, I do a large volume of foot and ankle reconstructive surgery, but using biomechanical principles. I teach a course called Biomechanics at the Pennsylvania College of Podiatric Medicine, which became the Temple University School of Podiatric Medicine. So it's always an approach that's taken that deals with all aspects of how the foot works, what it has to do, why deformities develop, what I can do to alleviate the symptom. That's why patients come in to see us. In today's world, I must add, another element is that they've been on the internet looking and viewing
Yes.
and seeing what opportunities or options are out there and who is doing it and who is being rated the highest on the internet by their peers or by other patients. So patients will come to me saying, I have a bunion that I've had for 25 years, it's killing me, I want you to correct it for me. That's a different type of patient, as opposed to somebody who starts to develop a bunion, doesn't need surgery, and we're trying to prevent it from getting worse.
Understandable. Could you tell me one of the most difficult cases that you have encountered and how you approach that situation?
Probably you go into areas of trauma which become difficult cases, or youngsters who might be born with a clubfoot deformity, which is a major deformity that's going to require a significant amount of dissection and surgical care. So it's always an approach that has to be taken with the patient, and my own thinking as to step by step. And I've always felt that the enemy of good is perfect. So when you look at something that we could consider a train wreck, and you want it to come back to absolute perfection, that's never going to happen. What you're trying to do is getting it to be more functional, so the patient can continue a comfortable life. So in trauma, where an ankle may be completely smashed, and you're trying to put it all back together and have a patient walk, we realize that over time, that ankle is going to undergo degenerative arthritis, and they may need an ankle fusion, or they may need a total ankle joint replacement. So you're always dealing with complexity, try to do it as simple as possible, but recognize that forces that do take place and demands will create continued problems.
I really like that. The enemy of good is perfect. So as podiatrists, we're always dealing with different people that come in with similar pathologies but very different, unique to that person. So can you tell us a little bit about your theory about getting people back on their feet, especially with the aging population and how people are going to be needing to be ambulatory for a longer period of time?
Well, it's a good question. First of all, you have to understand who your patient is, what their functional demands are, and what their expectations are. Somebody could be 75 years old, and we think of them as older part of the population, and yet they're playing tennis, they're playing golf, they're bowling, they're dancing, they're running around, they're going on vacations. At the same time, they're not necessarily the best of surgical candidates. Their circulation may be impaired or reduced. They may be diabetic. Unfortunately, as the population is aging, these other conditions become more apparent. Now that is going to limit what I can and can't do for a patient. That's not to say that my goal is to get you as comfortable as possible so that you can enjoy life.
Sure.
Now, unfortunately, there's times when I have to operate. Severe degenerative arthritis of a big toe joint or an ankle joint that needs replacement. These are important to enable a patient to continue a healthy lifestyle. Activity is critical. Motion is life. I want people up and around and moving. At the same time, first, do no harm.
So you've been in practice for a very long time. Where would you like to see the field of podiatry go? In light of the new show, My Feet Are Killing Me, what would you like to see more of podiatry in how it's represented?
I think the profession and the public has to realize that foot and ankle is a very unique part of the body. It's sandwiched. The foot is actually sandwiched from between the ground below and the body above. So it's like, just think in terms of squeezing two pieces of bread together with peanut butter and jelly and watch everything squish out. The profession cannot, however, be only a surgical profession. The need for foot and ankle surgery has a limited space. The areas beyond that are critically important. You can be a wound care specialist. You can be dealing in pediatrics, sports medicine. Areas that are interesting, enjoyable, geriatric medicine, rehabilitative medicine, all related to the foot. And of course you have problems such as an ingrown toenail, which is common. So the profession has to be prepared and ready to treat patients from a conservative, a medical, and a surgical standpoint. But surgery is not the be-all and end-all.
Right.
Not every doctor is a surgeon. There's only a limited number of times.
I absolutely agree. So we need a very holistic view of podiatry and all of its subspecialties in order to be effective and good podiatrists and good ankle surgeons.
That's correct.
All right. So anything else you would like to comment on as far as podiatry goes, as far as your career, anything?
There's no profession that's in medicine versus podiatry that has a more comprehensive approach to foot function and how to deal with all of the signs and symptoms that we see as podiatrists. It's a tremendous responsibility that we have to keep people walking, active, and enjoy a lifestyle that they want and that we can provide. Nobody does it better than a podiatric physician.
I couldn't agree more. Well, thank you so much for this interview, and here we are again at the Indigo Hotel in Los Angeles, and I thank you so much for your time.
You're quite welcome.